Introduction to blood pressure. Blood pressure refers to the force of blood pushing against the walls of the arteries as the heart pumps blood throughout the body. Blood pressure readings are given as two numbers, with the systolic pressure, the top number, representing the pressure in the arteries when the heart beats, and the diastolic pressure, the bottom number, representing the pressure in the arteries when the heart is at rest. What is high blood pressure? High blood pressure, also known as hypertension, occurs when the force of blood pushing against the artery walls is consistently too high. This can cause damage to the arteries and increase the risk of heart disease, stroke, and other health problems. Types of high blood pressure. There are two types of high blood pressure: primary hypertension and secondary hypertension. Primary hypertension is the most common type and has no identifiable cause. Secondary hypertension is caused by an underlying condition, such as kidney disease or sleep apnea. What is low blood pressure? Low blood pressure, also known as hypotension, occurs when the force of blood pushing against the artery walls is consistently too low. This can cause dizziness, fainting, and other symptoms. Causes of high blood pressure. The exact causes of high blood pressure are not known, but there are several factors that can increase the risk of developing the condition. These include age, family history, being overweight or obese, lack of physical activity, smoking, and a diet high in salt. Causes of low blood pressure. Low blood pressure can be caused by a variety of factors, including dehydration, blood loss, heart problems, and certain medications. Symptoms of high blood pressure. High blood pressure often has no symptoms, which is why it is sometimes called the silent killer. However, in some cases, high blood pressure can cause headaches, dizziness, and nosebleeds. Symptoms of low blood pressure. Symptoms of low blood pressure can include dizziness, lightheadedness, fainting, and blurred vision. Consequences of high blood pressure. High blood pressure can cause damage to the arteries and increase the risk of heart disease, stroke, and kidney disease. Consequences of low blood pressure. Low blood pressure can cause dizziness, fainting, and in severe cases, shock and organ failure. Risk factors for high blood pressure. Lack of physical activity, smoking, and an unbalanced diet. Risk factors for low blood pressure. Risk factors for low blood pressure include dehydration, blood loss, heart problems, and certain medications. Diagnosis of high and low blood pressure. Blood pressure can be measured using a blood pressure cuff and stethoscope or an electronic blood pressure monitor. A healthcare provider may also order additional tests, such as blood tests or an electrocardiogram, ECG, to help diagnose high or low blood pressure. Treatment of high blood pressure. Treatment of high blood pressure may include lifestyle changes, such as losing weight, exercising more, and eating a healthy diet. Medications, such as diuretics, beta blockers, and ACE inhibitors, may also be prescribed. Treatment of low blood pressure. Treatment of low blood pressure depends on the underlying cause of the condition. In some cases, lifestyle changes may be recommended, while in other cases, medications may be prescribed. Lifestyle changes that can help to lower high blood pressure include losing weight. Being overweight or obese can increase blood pressure, so losing weight can help to reduce blood pressure. Regular exercise. Regular physical activity can help to lower blood pressure. Aim for at least 150 minutes of moderate intensity exercise per week, such as brisk walking, cycling, or swimming. Healthy diet. Eating a diet rich in fruits, vegetables, whole grains, and lean protein can help to lower blood pressure. Limiting salt, saturated fat, and processed foods is also important. Limit alcohol intake. Drinking too much alcohol can raise blood pressure, so it's important to limit alcohol intake to no more than 1 drink per day for women and 2 drinks per day for men. Quit smoking. Smoking can damage blood vessels and increase blood pressure. Quitting smoking can help to lower blood pressure and reduce the risk of heart disease. Manage stress. Chronic stress can raise blood pressure, so it's important to find ways to manage stress, such as through relaxation techniques, mindfulness, or therapy. Get enough sleep. Lack of sleep or poor quality sleep can raise blood pressure, so it's important to aim for 7 to 8 hours of sleep per night and practice good sleep hygiene. Lifestyle changes for low blood pressure. Drinking plenty of fluids, especially water, to stay hydrated. Increasing salt intake in moderation. Eating smaller, more frequent meals throughout the day. Avoiding standing or sitting for long periods of time. And gradually increasing physical activity levels. In some cases, compression stockings or abdominal binders may also be recommended to help raise blood pressure. It is important to consult with a healthcare provider before making any significant changes to your diet or exercise routine. Thanks for watching.